The World Health Organization reported a 16% drop in new COVID-19 cases last week amid a global vaccine rollout. We take a closer look at some of the possible logistical challenges that may arise from the rollout and what we could learn from other countries. We speak to Astro Muhammad Khalid, Chief Executive at the Galen Center for Health and Social Policy.
Generally, three main areas that there could be problems or challenges which pop up. And that is, one is cold chain capacity, two is storage requirements, and the three would be last mile delivery. Now, almost every country that has started rolling out the COVID-19 vaccines has encountered challenges along the way. So we are already seeing that the Malaysian government, that it is already learning from many of these hard-won and expensive experiences and lessons learned from other countries and putting into place mechanisms which prevent, or actually try to prevent, some of the logistical problems from happening which could lead to wastage. And last mile delivery is going to be one, if not the greatest challenge. You've done everything you can to ensure that the vaccines arrive to the vaccine storage centers intact and with their integrity unblemished. How then do you ensure that they get to vaccination sites and shots to arms within a short space of time, especially in rural healthcare centers? Imagine, you've done everything right, but people may not be coming forward to get vaccinated. And your vaccine doses sit in your freezer at the site and the clock is ticking. So we need every shot to be utilized and not wasted. And unfortunately, we have seen this very scenario which I just described occurring in many countries around the world where vaccines are lost in transit or they sit in freezers without people coming forward to get vaccinated. So there's a lot that the Malaysian government can learn from what is being done in other countries, especially in those countries which the vaccine rollout has been tremendously successful.
With the amount of preparation being put in by the government, Azrul is confident that Malaysia is ready to receive the vaccine when it arrives.
So I think there's quite a lot that has been put into preparation by the government at the moment. It's really the devil's in the details, but really it's the implementation later on that we're going to start seeing a lot of these problems pop up. And it's going to be something that the government has to think on its feet and solve many of these problems as they come along. I mean, it will take a while before it irons out, but basically we're going to see some initial hiccups, but after that it'll be a lot better, hopefully.
More on vaccine rollout and its logistical challenges. Taking into account the first batch of Pfizer-BioNTech vaccines require ultra-cold temperature of -70 degrees Celsius. Special advisor to the Minister of Science, Technology and Innovation, Khairi Jamaluddin, Associate Professor Dr. Muhammad Gaus Muhammad Azam explains the government's plan in facing possible challenges.
For a backup plan, I think we've mentioned this previously, even before we bought the ultra-cold freezers. In Malaysia, these ultra-cold freezers are not uncommon. Most universities have them. I mean, we did a very rough calculation. I mean, at least in the universities all over Malaysia, we have more than 125 ultra-cold freezers available. And these are just the universities. We also have ultra-cold freezers in NIBM, our National Institute of Biotech. So we have plan B, plan C, all ready to come into play if required. But the new ultra-cold freezers that MOH have bought, I think, should be more than enough to cover all the vaccines, the Pfizer vaccines that we are getting. And for the -20 and 2 to 8 degrees, that's even easier, and the capacity is already there to handle all of these vaccines.
He said the main challenge is not storage or logistics, which will be handled by the vaccine supply companies themselves. For him, the main concern is getting enough people inoculated.
We're probably not going to keep the vaccines for very long. Once the vaccine arrives, we probably try to vaccinate people with it. We're not going to store it for too long. So there is also this rule where MOH is going to when you receive the vaccine, right, half of the vaccine is going to be stored for your second shot, For example, like the Pfizer vaccine, the Sputnik vaccine, they all require 2 doses. So they have this one shot, one reserve policy where half of the vaccine is going to be stored for the second dose. But even if they are stored, they're not going to be stored for very long. Pfizer vaccine requires 21 days between dose 1 and dose 2. So they are just going to be stored for 21 days. After that, we're going to try and use it as much as possible.